More than 5 million Americans are living with Alzheimer's today, and now a brand new bombshell studies reveals it may spread.
Yeah, and although it's not necessarily contagious, the seeds of the disease can be passed from person to person, according to this new study. Here to explain is neurologist and medical director of the Deep Brain Stimulation Program, Dr. Fiona Gupta. Nice to see you this morning,
Thank
Doctor.
you.
What did you think when you saw this study?
Well, I think like most people, it was panicking. You know, I had tons of calls come into the center. Is Alzheimer's disease contagious? But when I further delved into the study, I saw that no, you cannot develop Alzheimer's with close contact or sharing living quarters with someone with Alzheimer's. In fact, it was a very intricate study showing that patients who were exposed decades ago to a growth hormone that was taken from cadavers may have developed the seed of Alzheimer's.
But it suggests that there's an agent out there that might cause Alzheimer's, doesn't it?
Oh, absolutely. There's what we call the seed of Alzheimer's called beta amyloid. So in these autopsy studies of patients who died of a different disease called CJD, which is a very fatal but rare disease, these brains actually showed this amyloid seed that could develop into Alzheimer's disease in these patients. We do know that that CJD was caused by extractions of this growth hormone that they received as children decades earlier for stunted growth. So the question raises, could Alzheimer's, the protein, be similar to the CJD protein and replicate and spread? But by no means is it contagious through contact or, you know, being on the subway or sharing living quarters with a patient with Alzheimer's.
Yeah, well, I think that's the key that everybody wants to hear, to put it in layman terms. This is also from the study about the spread of Alzheimer's, that there would be some sort of abnormal protein that would be depositing around the brain, also resistant to sterilization. So that wouldn't be good if you're in the middle of surgery in the hospital, especially because it can stick to surgical instruments, according to this study as well. So should we be worried when we go to have surgery in a hospital?
So absolutely. So remember, the brains that were studied were patients who died of the CJD, the Creutzfeldt-Jakob disease, which is the prion disease. That protein is very sticky, and it can even be resistant to sterilization technique. You know, we don't know enough about the beta amyloid that causes Alzheimer's to really see if it can be resistant to sterilization. But I always encourage my patients, whether you're going for a minor or major procedure, really research where you're going and make sure that sterilization techniques, safety precautions, things like blood transfusions and so on, are really under protocol.
Ooh, so no more surgeries in Kinshasa, no matter how cheap they are.
Try not to.
Good call.
Yeah.
Of course.
Dr. Fiona Gupta, we appreciate you joining us this
Thank
morning.
you so much.